Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today in the home office studio of the Beverly Hills Roxbury Clinic and Surgery Center with, of course, my most faithful co-host, Dr. Millicent Rovelo.
Good evening.
How are you doing?
I'm doing really well.
We are in our new setup.
I did. We finally took it out of the box.
We did need to do that.
It was in the box for a little while. It sat in the box
for quite some time.
Yes.
Well, we're busy. We're doing surgery.
I know.
That's what we do here. We're not, and by the way, we didn't do it.
We totally did not. I think we hired someone. Actually,
Yes.
We didn't even hire someone. Caroline hired someone.
She hired someone from one of the apps who came in and took care of business.
Yes. But now we have a new setup, so we can't slouch on our couch anymore. Dr. Seussed that one.
That's a bummer.
No slouching on the couch.
I like slouching on the couch. That was good.
You got to sit up straight now.
Okay. Well, today we're going to talk about how to choose your plastic surgeon.
Yes. And I think we've touched on this before, but we're just revisiting it because it's kind of a hot topic. Like everybody wants, to have plastic surgery, but then it gets really hard. How do you know who to go to? If you're not entrenched in the world of plastic surgery or medicine, it just seems like a daunting task to find a plastic surgeon.
It is. And because
especially if you are in this Beverly Hills area and you can't walk down the street without running into a plastic surgeon.
It's true.
Other parts of the country, it might be a little bit easier because there's 3 in the city. But here, you have to step over them when you're walking down the street.
Well, but it's also a case of, will the real plastic surgeon please stand up?
And then there's that.
Right? So as I always say, the internet is one of the things that in this world that by spending time using it, being on it, you can actually become dumber.
Okay, explain.
Well, the information is not reliable.
No, it's not. And then you come in, the problem is you come in thinking you know a lot and you actually don't. But then because you think you know a lot, you're not open to learning what you don't know, and it's a problem.
How many patients come in to see you with a sheet that they've printed out from the internet? Mm-hmm. By the way, we don't print the internet.
We don't print the internet. We're not turning into our parents.
That's right. I love that. We don't. No. We don't print the internet. So they come in with a printed sheet of questions they're supposed to ask their plastic surgeon.
Yes, as recommended to them by Elle and InStyle magazine. Right. And I can tell, and God bless them, I can't fault them for it because they're trying. They really are doing their part to try and legitimately find a plastic surgeon. But the tells are when they kind of look down and then they look up and they go, so how many of these have you done? And I give them some answer. Oh, okay. And then they look down again. How many a week do you do? Oh, okay. And they look down again. Are you board certified? And God bless them. These are all important questions. But what the problem is, what does that number mean to you? And then we're gonna go back and do this legit, people, from front to start, how to choose a plastic surgeon. But just on this one little topic, if I told you that I do 50 breast augmentations in a year or 200 breast augmentations in a year, what is the right number? A, to be competent. Nobody really knows. And B, how do you as a prospective patient know what that number should be?
Right.
So that number on its own doesn't mean a whole lot.
No.
So how do you find it? Let's start from the very beginning. You're thinking of having XYZ plastic surgery. You live in town Y. What's the first step that you should take in finding a plastic surgeon?
Well, what most people are going to do is Google it.
They're going to Google it.
They're going to go to Google and they're going to do a search and say plastic surgeon near me. And what's going to come up are a mixture of paid advertisements, sponsored ads, and people that have probably paid to have their site show up very high in the ranking results. And for most people, the sponsored results will be enough, and they will be happy to click on the sponsored results, not realizing that those are paid ads, which is okay.
Which is totally fine.
Right.
That just means someone's...
I pay for ads. I pay Google some amount of money to have my ads show up. But the problem is that hasn't solved the, is this person any good question for the searcher, for the person who's the prospective patient.
It's given a list of names,
That's
a
all
list
it is.
of potential people. And that being said, Google does have some other algorithms, supposedly, that will bump surgeons or whatever you search higher to the list. So if one particular surgeon has a really high SEO, they do a lot on Google, on YouTube, on social media, all these things will sort of bump them up if they've been on the internet for a longer period of time. There are all these things that...
SEO?
Yes.
What is that?
I have no idea, but it's a word that our marketing people use.
I was asking you for Tracy in Wisconsin.
Well, all I know is that it's SEO, and that's what my marketing guys tell me.
It stands for search engine optimization, and what that means is that your site has been optimized for the search engines. All that is that they've added things called meta tags, which are basically words that you put into the code of your site that gets Google to recognize it as a site representing whatever you've tagged it as. And Google does check to see that the tags match up with your content, et cetera, et cetera. So if you have a good website, quote unquote, then the SEO will help you show up more. That still doesn't mean that you're any good at this.
Doesn't mean any good, but you've got a good marketing team, you have a good web building team, and that's how you get your list. You can also go to social media. You can go to Instagram or TikTok now or Facebook, do a similar search, plastic surgeon Beverly Hills. Oh my gosh, you'll get like 13 million hits. So there are other ways that you can sort of find a list. I think one of the best ways, if it's available to you, is to ask friends and family. Word of mouth is the best referral possible, assuming that they like their surgeon and they had a good result. And for the most part, people are very happy to refer you to their plastic surgeon if they really like them, if they're happy with them.
Yeah.
Now, not everyone's very open, as we are in this part of the world, about having plastic surgery. So it might be harder if you don't know somebody or you're not comfortable asking them. But if you do, if you know someone that's had plastic surgery who's comfortable talking about it, that is really the best place to go, because that's going to be a verified source with a verified result. So there you are. So say you somehow compile your list. You've asked friends and family, you've asked the Google, you've done your social media search. You now have a list of potential plastic surgeons. What do you do with that list? And I will say the very first thing you should do with that list is check to make sure they are actually plastic surgeons.
Well, how do you do that? I mean, because that's not easy. There's a lot of mumbo jumbo terminology that people use.
Yes.
That there's the American Academy of Cosmetic Surgeons, or there's all these different acronyms and letters and things that people like. If you look at our names, we are J. Calvert, MD, FACS, which stands for Fellow of the American College of Surgeons, and I have an MD degree. I'm a medical doctor. And you have the same thing. You are also a Fellow of the American College of Surgeons. A lady fellow, that is.
I'm a lady fellow.
Yes, you are a lady fellow. But that means that your practice, so for the listeners at home, that means that you and your practice have been evaluated by the American College of Surgeons, and it is found to be worthy of giving you a fellowship status in the College of Surgeons, which is a big deal.
But that's not plastic surgery.
No,
so that's where it still
and
gets
it still
tricky.
Doesn't mean you're any good.
And it still doesn't mean anything.
No.
Well, it means a lot to us.
It means a lot to us.
But it doesn't mean a whole lot to the patients. So when you're looking at plastic surgeons, also known as cosmetic surgeons, aesthetic surgeons, there are 3 potential categories that you can have that are actually surgeons. And we'll get into the ones that are not surgeons. But as a surgeon, you can be a plastic and reconstructive surgeon. That means that you've done a plastic surgery residency, you've completed that residency, you've taken your boards, you're a board certified plastic surgeon. And maybe you've done a fellowship to do additional fancy things for another year, but you're a plastic surgeon.
Right, and that means you are a plastic surgeon as described by the American Board of Medical Specialties, ABMS.
Right, which governs all boards of any kind of medicine in America.
Correct. And they're boards that have met the standards of the American Board of Medical Specialties. So that's very different, because there are other boards that are not American Board of Medical Specialties, which doesn't mean anything really. It just means that they're a different degree of a board.
Different degree of a board. I mean, you can be board certified in anything, but there's only a select few that are part of the American Board of Medical Societies that have legitimate residencies, that have been
medical specialties,
have been vetted and have been approved to be a board certified something.
They have applied. By the way, these are private corporations, and they have applied basically to have specialty status. For instance, boards like thoracic surgery, for vascular surgery,
general surgery, medicine, OB-GYN,
pediatrics,
the whole gamut.
Endocrinology. Like, these are very specific medical specialty boards that are accredited by the American Board of Medical Specialties.
Right. So that's one option. That's plastic surgery. Then you can have a facial plastic surgeon. This is someone who typically has gone through an ENT residency, ear, nose, throat residency.
Or plastic surgery.
Or plastics,
right.
but typically ENT.
Right.
And then they've chosen to do an additional year or two of training focused specifically on plastic aesthetic surgery of the face. So they've taken their more reconstructive residency of ENT and then done a couple of extra years training on doing aesthetic procedures of the face. Typically, these surgeons do not do aesthetic surgery below the face and neck area. So these are not going to be surgeons that are going to be doing breast augmentations, liposuction, although some do. That is not what they are technically trained to do. Right. They typically stay in their wheelhouse, which is, the head and neck area.
Right. And these are extremely competent surgeons.
Yes.
And well trained and amazing and all that stuff. And they're our colleagues, blah, blah, blah. I will also tell you that the American Board of Facial Plastic Surgery is not an accredited board of the American Board of Medical Specialties, which doesn't matter because they conduct themselves as a legit board. They test people in, they have criteria to get in, but for whatever reason, they've either just haven't applied or they don't meet the criteria in some way, shape, or form that it is not an ABMS specialty. As far as I know, maybe that's changed in the last 15 minutes or whatever, but and I don't think that has anything to do with anything.
It does not. I don't think it does.
It doesn't. I mean, it's a really good board. They have they're all about their fellowships. I mean, there's a ton that goes into running that board and holding that specialty to a very high standard.
Yes, I 100% agree. And then the third category of surgeon is cosmetic surgeon. So a cosmetic surgeon is someone that's done some other kind of residency, usually general surgery. I've seen it with ophthalmology, maybe ENT, some kind of surgical oriented residency. And then they've gone on and done usually 1 year of a cosmetic surgery fellowship. And so they can technically do anything, facelifts, nose job, breasts, tummy, but they've only had 1 year of training. And they like to say, oh, well, we are better trained than the plastic surgeons because our fellowship focuses only on cosmetic and aesthetic surgery. Plastic surgeons do reconstructive surgery for their entire residency.
Which isn't true.
I've heard this.
Yeah,
so
I've heard that too.
That's so not true. You can't compare 7-8 years of a plastic surgery residency with 1 year of a cosmetic surgery residency. You just can't. And they do have their own boards, and they say that they're board certified, and they're also not ABMS. They are not ABMS, but there are some good cosmetic surgeons out there. It's just a different way, sort of getting to the same place, kind of, not really.
Well, and I want to touch on this because Dave Stepien brought this up, our fellow this year, and I said, there just is some difference to the way that I see aesthetic surgery being done. And I see it across the specialties, and there are good and bad surgeons in every specialty, and there are average ones and fat ones and tall ones and short ones and blue ones and green ones, etc. So you get everything. But when we go to our meetings and you see the folks presenting about blepharoplasty or about rhinoplasty or about facelifts, I just see there's a big difference in the board certified plastic surgeons and the way that they discuss these things. And he said very simply, it's because a plastic surgery residency is a minimum of 5 years and a aesthetic fellowship is 1 year.
1 year.
So that's the difference. And it's not that they can't become great surgeons in aesthetic surgery. It's just that our running head start of a minimum of 5 years, mine was 7, and I did aesthetic surgery the entire time I was in my residency, the entire time. Yes, we did lots of reconstruction too, but
But the reconstruction itself
is aesthetic surgery.
Is aesthetic surgery, and it teaches you the principles and the anatomy and how to take care of complications. Like there's so much that goes into doing a 6 to 8 year residency in plastic surgery that you just can't match with a 1 year. With a 1 year fellowship.
No,
you just can't. And it's not going to be as academic. It's not going to be as rigorous. The understanding of the anatomy just isn't going to be there. So
and we're exposed to it every week. Yeah. Every week we had aesthetic surgery conference. Every week.
Right.
For 7
and you
years.
go over the cases. You go over the complications. You break it down.
It's different.
It's neither here nor there. That's
right. It doesn't mean that somebody with a 1 year fellowship can't do amazing work. They can.
Yes.
But there is just something that I see about how it gets done and what the results are that, I think that it's important for the listeners at home to get that, like, evaluate your choices with not just, apples and oranges. You want to try to match up apples with apples, and so that you can see which ones are which you're looking for.
Actually work.
Yeah.
And then those are your surgical options, which you would think would be where you'd stop.